Hello.
I thought you were going to do more.
Oh, you say hello.
I know, you're right. Start over.
Hello.
Hello. Welcome to Honey Do Me Podcast. I'm Cass.
And I'm Emma, and this is our podcast where we talk about sex, relationships, friendships, macrame. Just kidding. We've never talked about macrame. But we do talk about hobbies or things that we're interested in every now and then, but a lot about your pleasure and mental health.
Yeah. How's your mental health? What are you up to?
I'm doing pretty okay. I am off to a girls' poker night tonight.
Obsessed.
So I know. So a couple of my girlfriends and I, we were like, okay, we kind of want to learn how to play poker, but we don't want anyone's boyfriend to try to teach us.
Yeah.
Like that sounds awful.
Awful.
So we're like, we should just make a girls' poker night. And so we're getting together, and I got a poker set for my friend, and we're just going to have drinks and pizza and like learn how to play poker together.
I'm obsessed. I love it.
Thank you. If I had better planning skills, I would have constructed an outfit to match Hallie from Parent Trap when
Obviously.
she walks in her jacket, her little bomber, and like a sock full of nail polish and coins. But I do have glasses and I do have pigtails today, so...
And you do have a sock full of nail polish and coins.
And I do have a sock full of nickels and screws. But yeah, that's what I'm doing.
What's great about the sock, too, is it's a weapon for when you're walking to and from your car.
That's what I'm saying.
Like, you're good.
Exactly. Yeah, and I get to bring my dog. So it's just going to be a great evening.
Amazing. I love that for you.
Thank you. How are you?
I am fine. I am just doing good enough. I've been trying to get on my Peloton that I bought during COVID.
Yeah, you did.
And used as a coat rack for a couple years. So if you're also one of those people, I'm right there with you, equally as ashamed and in debt.
And in debt. That's so funny. Is my account still on there?
Ago. Yes, your account is still on there.
Balls.
Balls. Yeah, so very fun. And that's all I've got going on. No poker for me. But speaking of poker, we're talking
I hardly know her.
about penises today. But more like when you're having trouble poking. We are talking about erectile dysfunction with Melissa Hadley Barrett. And she is a nurse practitioner and sexologist who specializes in ED and prostate cancer and all of these things that are so important that we've actually never really talked about on the podcast before.
No. And I mean, we talk about things that get in our way sometimes for pleasure. And I feel like this is a perfect topic to dive into because there's very natural reasons. There's like things that could be going on just personally. And we all, as partners of people or people experiencing ED, need to be there and be like a supportive teammate.
It's not a big, shameful, scary, embarrassing thing. It's so normal. Like, she'll go over the statistics and you'll be like, oh, so it's
I couldn't believe it.
Most people.
Yeah.
It just happens when you're getting older, babe. Just happens.
The fact that I've met an erect penis is like shocking at this point.
Honestly, I should be shocked and alarmed I've met one erect.
What an erect. Oh, Jesus. But yeah, it is. She's just a dream. I love when we get guests on here, which is all of them, but that
every
are just
week.
So they just have all of like the medical answers, but also can speak to like the more psychological side of things, like when it comes to sex, because it's all fucking connected. We know that through and through. So
she'll cover all the reasons that you could be experiencing ED, what to do in the moment, some things that might work, what to do long term. She talks about penis pumps, and I had no idea that they were like a good thing.
Pumped me away.
Yeah, there's just so much in this episode, and it's so much fun. And a penis Fitbit. So if nothing else, stay for that. So
stay for that. With that, we'll see you on the other side.
Bye.
So my name is Melissa Hadley Barrett, and I'm a nurse practitioner and a sexologist. I started off my career as an emergency nurse, and then I somehow ended up working in remote areas as a midwife and an emergency nurse. I was the only person in like communities of about 3,000 to 5,000 people, and the only practitioner. And then I went into general practice in about 2011. And then I just had heaps. I was working in a practice that was mainly men. So I had lots and lots of people come in, men and women, and all the other practitioners were male. So they would always seem to gravitate to me about sex problems. And I was in my 40s at that stage, and I in particular had this patient come in who had used to work in emergency department with me when I was in my early 20s. And then she was in her 40s, and she was always coming on night shift and telling me about her wild sex life. And as a 22-year-old, I was disgusted that someone that old had sex. So I sort of used to go home to my newly married and say to my husband, oh, it's this old bird at work, so it's telling me about her wild sex life. It's disgusting. I think she'd be over that by now. Anyway, many years later, 20 years later, she came in and she came in for a pap smear. I don't know if you call it that, or a cervical screen.
Mm-hmm.
And I went to do it, and she had a very dry, painful vagina. And I was like, oh, I haven't seen you for years, but I remember you were really sexually active. By this stage, I'm in my 40s. She's in her 60s. And she burst into tears and said, oh, we don't have sex anymore. My husband had his prostate out 2 years ago and he's depressed. He won't even hold my hand. And she was really sad. So she was like, there's no point to getting this fixed. So I was like, finished the pap smear, got her off the table and said, sit down, let's talk about it. And we chatted about it. And it turns out that, a lot of men, when they have their prostate treatment, will end up with erectile dysfunction. And he just spiraled into this depression. They were completely unconnected in their relationship. And I didn't know anything about prostate and erectile dysfunction really, other than prescribing a bit of Viagra. And so I said, let me find out about it, went away and found out. And I ended up disappearing down the rabbit hole and fixed their problem. And then it kind of got, I was living in a town of about 20,000 people at the time, and it got around. And then I started seeing more and more sexual dysfunction. And then I went to my husband, who was a different husband by this stage, which explains the two surnames. And I can't have any more. I wouldn't fit it on a passport form. And so I then said to him, I want to go back and study a postgrad in sexology. And he was like, that's really cool. I'd much rather tell my mates I'm married to a sexologist than a nurse. And that's how I ended up here. So I did work with a mentor for 5 years as a sexologist and a generalist, and then in GP land. And then for the last 7 years, I've run my own practice on its own, and I've had the practice running for 9 years. And I have 4 other clinicians working with me in my practice, and most of us do mainly men, which is interesting because I really thought when I went into this field I would see mainly women, particularly because I had a midwifery background. But I think men find it more easier to talk to women, especially middle-aged women, than they do other men who are their peers about their sexual dysfunction. So we see a lot of couples, and I do have one practitioner who still sees women. So often we'll see couples and then they'll both have a physical issue, and one of us others will deal with the guy's physical issue. She'll deal with the female's physical issue, because often these things are, as you know, they come together, and then I'll do some couples work with them as well. So, yeah, and other than that, me personally, I'm in my 50s. I have a 27-year-old and a 24-year-old that I gave birth to, and I have 2 stepchildren and 5 grandchildren.
5 grandchildren? How lovely.
Yeah.
Wow. Well, talk about a life path that really ran you right into what you were made for. If you feel like this work is what you're meant to do and you're helping so many people, that's incredible.
And yeah, I love it. I've loved every job I've had, and I've done a lot of different things. I've been an academic and I've done research, and I sort of feel the great thing about nursing is it enables you to transition your work path as you go with your life stage. So I found it when I had children, I loved being a midwife because I had babies and I could identify with those people. But now I do have a lot of young patients as well, but a lot are probably middle-aged. And so I'm at that same lifestyle stage, so I can identify with their issues from a personal level as well.
I love it. And coolest grandma ever, right?
Maybe. One of my granddaughters says, I know what you do. My grandkids call me Molly, and she said, you're a sex doctor. And then she giggles. She's only like 4. It's very funny.
Oh my God, I love that.
That's so cute. Well, they're going to be so educated, and I love that. So you touched on erectile dysfunction, and that's definitely what we want to focus on today. So can we start with a basic definition of what erectile dysfunction is?
Yeah, so I think people often think of erectile dysfunction as just you can't get an erection at all, and that's not true. It can be any problem with your erection. So you might not be able to get an erection hard enough for penetration. You might not be able to get an erection at all, or you might not be able to maintain the erection. So, you might wake up every morning with a great erection, and then when you try and have intercourse, it goes down. Or you might be able to wake up and have these spontaneous nocturnal erections, but when you're trying to be aroused, he doesn't come to the party. So it's really any definition around erectile dysfunction, in my opinion, should just be when your penis isn't doing what you need it to do for you to be satisfied and for your partner to be satisfied.
Okay.
Yeah.
I like the broader definition. I feel like that. Yeah, it's helpful. I feel like one of the issues around identifying erectile dysfunction is shame. So can you talk a little bit about the shame aspect?
Yeah, I think shame is a really big part of it. And I think it's because, particularly women, we don't realize, and I never realized how much a man's self-esteem and the way they feel about themselves is attached to their sexual function. And I think that a lot of people, probably women in particular, would listen to this and scoff. But I think if we turn that around and think, if I got told tomorrow I had breast cancer and I had to have a double mastectomy, I would feel as though that it would change my femininity and my view of myself. And for men, their penis is usually hidden, it's in their pants, but knowing that it works and it can do what they want it to do when they want it to, or just waking up in the morning and seeing it doing what it's supposed to do as part of their natural function, is a whole lot about their identity, and it's a barometer to their health and how they feel about themselves. So I think then on from that comes the shame that I'm not the man that I used to be, I'm not the person that I used to be. And then I think there's another problem that, and I've heard you girls talk about this, that you chat to your friends about sex and your body. Men don't do that generally. And I mean, maybe American men do, but Australian men definitely don't, which is why we started that podcast, The Penis Project, because I'll have a guy sit in front of me, he won't be able to have eye contact. And I'll say, so what's the problem? And he'll go, oh, my penis isn't working properly. And I'll go, well, you do know that 1 in 5 men under 40 will have an issue with this at some stage in their life. And once you hit 40, it just keeps going up. By the time you're 50, 1 in 3 men can't get an erection without help. By the time you hit 60, it's 1 in 2. And by the time you hit 70, only 1 in 5 men can get an erection without a pill or something. So It's pretty much a universal problem, but I think everybody knows that women get dry vaginas, or sex might hurt after childbirth, or we get thrush. But I don't think many people know about what goes wrong with penises. And I think if we could dispel that myth, then the shame wouldn't be quite so bad.
Absolutely. And I think what would also help is knowing maybe why, because as a partner who has been with someone with a penis, who there's been like instances where there's been erectile dysfunction before sex, and I don't know why it's happening and they don't know why it's happening, it can cause kind of this ridge in the relationship where you just don't know how to communicate and work through it. So what are some reasons why erectile dysfunction does happen?
Yeah, so I think that's really a really great question, because I think also women often take it personally when a guy's penis doesn't work, because, you watch a movie, someone, you only have to look sideways at some guy and he gets it up, So I think, there's not a lot of help there. You don't very often watch a movie or a TV series where someone has erectile dysfunction, where you often see them where people have menopause or breast cancer. So I think the way an erection works is around the outside of a prostate is a group of nerves. And those nerves, I think of those, it's a very simple explanation, but I think of those as an electric cord that is going to boil a kettle. So you've got this kettle and you plug the electric cord into the power in the wall and you turn on the switch and the kettle boils. If that electric cord was frayed, you might only get a lukewarm kettle. You wouldn't get a boiling hot kettle. If the electric cord was completely snapped in half, you wouldn't be able to even warm the kettle up. So this is how most erectile dysfunction drugs work. They work like if you had a frayed electric cord and you got some electric tape, you'd wrap it around and suddenly the lukewarm kettle's boiling again. So that's how they work. But when that cord's completely broken, it doesn't matter how much electric cord you put around it, it's not going to work. So there's physical reasons why that might happen, and it might be as simple as lower back pain, injuries to your spinal cord. It might be people can have pelvic injuries. Any kind of pelvic surgery can affect a man's erectile dysfunction. The other thing that I see commonly in young guys is if they're really, really fit or very anxious men, they'll have a hypertonic, really tight pelvic floor. So when you have that really tight pelvic floor, which all of us women think is a great thing, unless we've got vaginas, you can have too much of a good thing. If it's too tight, then it actually blocks off the blood flow to the penis and it blocks off the blood flow to those nerves. So it's all about an electrical and pumping blood flow. So the other thing I think of is men who are really overweight will often have erectile dysfunction, and that's like you're trying to water your lawn and you park the car on the hose, the water doesn't get through. There's also hormonal reasons why people might get erectile dysfunction, but they're much less common than people think. Like most men will come in and go, my penis isn't working, I must have low testosterone. And that is not the issue. And you can actually have too much testosterone that will stop your penis working. So I think that's a really important thing. And men who take anabolic steroids for bodybuilding will often have erectile dysfunction. So, it's the hormone thing is, yes, there is a cause effect with that, but it's not as common as these other things that I talked about. And then a really common cause of erectile dysfunction is just anxiety. So I think it's really important for women to think when they're with a new partner, if he can't get it up, it doesn't mean he's not hot for you. It might just mean that he's really hot for you and he's really, really anxious about performing, and that anxiety has made him not. And my very basic example of that I explain to guys is in caveman times, you're in the cave, you're going for it, and a lion comes in to attack you. Well, you can't run away from a lion with an erection. I imagine it's pretty hard to run with one, and you can't fight one off. And so you get this big rush of adrenaline and it goes down. So adrenaline to a penis is like kryptonite to Superman. So any kind of anxiety, you put Superman in a room with a lump of kryptonite and he's floppy. You put a penis in a room with a heap of adrenaline and he's floppy. So yeah, they're the most common causes.
That's hilarious. And also, I've never thought about running with an erection. I wish that was something I could know what it felt like.
I know. I would love to have a penis for 24 hours. I'd like to imagine what it felt like to have an orgasm as a man, to try and run with a penis. There's all these things. I'd like to be able to go driving on a long trip and stand out of the car and just drop it out.
Drop it out. Yeah. Also, I would feel like the penis out of the way while my legs are brushing together, that would make me faster. But yes. Who knows?
Yeah, but it might be a target for the lion as well when it's sticking out there.
That's true. Yeah. Just a flag right here.
Yeah. Exactly.
Are there any other big misunderstandings that we have around ED?
I don't know, not really. I just think the biggest thing is that. I think the biggest thing is that we shouldn't take it personally if we're with someone who has ED. I think that's the real thing. And I think if female or, most, gay couples, they understand that because they've probably had that happen to them at some time in their life. So they're not going to be, in my experience, as offended by their partner not being able to maintain an erection. But I think for women, I think if we know that, I think it would save a whole lot of shame for the men and a whole lot of anxiety for the woman if we go, you know what, it doesn't necessarily mean that. And it's the same with premature ejaculation. Premature ejaculation has two sides to it. You can be born with that problem, but it can come along later. And that is often because the guy is really into you and he's so excited and nervous that happens. And then often premature ejaculation and erectile dysfunction go together because when a man has an orgasm, his erection will obviously usually go down. So sometimes it's actually not erectile dysfunction at all. The problem is premature ejaculation. And we think that we're dealing with ED, but we're dealing with PE.
Oh, wow. You're just like, all you got to say is no, we're done. Great. Yeah. Good job. Or at least you're done.
Yeah, you're done. And there's so many, and I think that's the other thing as well which is great about what you're talking about on your podcast, is educating men that heterosexual sex is not all about penis in vagina. Mm-hmm. And actually, in my experience, couples who suffer from sexual dysfunction often end up with a better sex life afterwards because it's not so penis-centric and they have to mix up the script and they have to go, there's other ways. And often when I speak to couples when premature ejaculation is the problem, the female partner will say, I don't really care, because it means that you pay more attention to my clitoris and my breasts, and you do other stuff afterwards. Like, it's, only 1 in 20 women can have vaginal orgasms on their own without clitoral stimulation. I mean, and that's something men need to know, so that they don't feel so that everything they're doing is about their penis. They've got lots of other things that they can do in their toolbox that will result in just as an enjoyable sexual experience as having a hard penis.
Definitely.
If you're in the moment and your partner is experiencing ED, do you have any phrases that we could use that, I guess, continue the sexual experience instead of make it kind of this shame spiral where everything stops?
Well, I think as the partner of someone experiencing ED, you have this really easy situation where you don't actually have to comment, and you don't even actually have to notice it. You could just say something like, you could say something like, I'd like to, oh, do you think you could go down on me? Or can we change position? Because often erectile dysfunction is positional as well. If a guy's on the bottom, then, gravity's working against him. So if suddenly you changed it to he's on top, or you do doggy style or something like that, that might change it up. So you don't even have to say, hey, it's going soft, how about we move? It can just be, you can initiate a change in position, or indicate that you would like him to go down on you or stimulate you in some other way. So, and often all that man will need is a little bit of time, and he'll recover. So I think it's more about deflecting that situation, so the fact that the penis has started to get soft isn't an issue, and it's not going to stop proceedings.
This may be an aside, but how long is a normal erection?
Great question.
Yeah, that's a really good question, and everyone's different. It's like the whole how big is a normal penis question. So I think a normal erection is probably about anything. If someone has an orgasm before 2 minutes, it's clinically considered premature ejaculation. But, premature ejaculation is only a problem if it's a problem for the couple. And also, I think people have an unrealistic expectation around that because of what we see on porn. So people watch porn and think everyone's penis lasts for 10, 20, 30 minutes. And usually those porn stars have had an injection that keeps it up. But yeah, the normal time would be 5 to 10 minutes, and that's all. And, and it is perfectly normal if you're having sex for half an hour, that penile function will wax and wane. It's not going to stay pumped up the whole time, unless you're a really young guy. But certainly after the age of about 30, you would expect it to wax and wane in that time, not stay rock hard the whole time.
Yeah. Nor would I want it to,
No,
I would like to wax and wane. That would be ideal.
Yeah.
When you're in maybe a long-term relationship and ED seems to be a cycle whenever you are starting to get intimate, and like, how do you approach that? What are those conversations like if you feel like every time it kind of brings up this anxiety, and then ED happens and now it's become a little bit more of an issue rather than something you can just jump to the next, like, sexual activity?
Yeah, I think that's a really good question. And I've actually experienced this in my own relationship, where like, my husband and I have been together 15 years, and, he's 61 now. And I know when he got to be about 55, I noticed that it wasn't the same as it used to be. And I was working as a sexologist and talking to people about this all day long. And I really struggled. It took me months to bring that conversation up at home. And, I never commented until one day I thought, I really have to. I'm such a hypocrite. I need to have this conversation at home. So it is, I totally understand that that's a difficult conversation to have. And the best advice that I could say is, don't talk about it during the act of intimacy. So you really need to bring that up at another time. And when you're not going to be interrupted, when it's private. And also for men, most men communicate better when you're side by side, not face to face. So don't go out for dinner and sit across the table and say, hey, I've been noticing that your penis isn't quite as hard as it used to be. Should we do something about that? I think it's more go for a walk, or when you're driving on a long trip. Driving is always a great one because you've got the person trapped there. They can't get out,
They can't run.
But, like, side by side is so much less confronting. Like, imagine if there was something going on in your genitals and your partner looks you straight in the eye and is like, hey, what's going on? It smells funny or whatever, like if you're side by side, there's a lot less shame around that. And I think also the other really important thing is that penile health is a barometer to your whole physical health for a man. So if you look at people who have had a heart attack, like a coronary event, usually within the 12 months to 3 years prior to that event, if you ask them, they will say, I did notice that my penis wasn't working as well as it used to be. I stopped waking up in the morning with erections. And that's because if you've got blocked arteries, the arteries to your heart are about the thickness of your little finger. The arteries to your penis are tiny. They'd be like the inside of a pen or a biro. And so they get blocked before your heart does. So particularly if you've got a partner who's at risk of cardiovascular disease or over 40, and you notice that the last few months his penis isn't working as well as it used to be, that's a really good opportunity to say, when you're side by side, not straight across the table, I have noticed, and it's not a problem, and I'm still satisfied, but your penis isn't working like it used to, and I know that can be a red flag for cardiovascular disease. I'm really worried about that. People who have this often will have a heart attack in the next 1 to 3 years. So do you think it's time you went and saw the GP and got your cardiovascular system checked? And while you're there, maybe ask about getting a bit of help with that.
Yeah.
So
go ahead, Em.
No, I'm going to say jumping to like your health feels more endearing than accusatory. So
Definitely. Yeah. And I know when I was in general practice, it's really difficult when some guy comes in about, a stubbed toe and he's in the age group, or you've seen his wife the week before and she said, oh, John's dick's not working very well these days. Next time he comes in, can you bring it up? And you think, Jesus, bringing it up, pardon the pun. But it's a bit tricky. So that was definitely a trick I use in general practice. Someone will come in and they'd come in for whatever reason, and if I had been alerted to that, or even if I hadn't and I thought they've got to that age, because it's hard for health professionals too to bring this up in a conversation about a cold or something, is to say, oh, you do know these statistics about cardiovascular health and penile function. So it might seem weird that I'm going to ask you this, but how's it working? And often all that guy wanted was the opportunity to talk about it, but he just was too embarrassed to bring it up. And then they'll pull their heart out and go, well, actually, it hasn't been working very well at all for blah, blah, blah. Is there anything I can do about it? And am I the only one? And then I think the next thing is to tell them those statistics, and they usually go, God, so next time I'm standing around with my mates, every third one of them's got the same problem. And I'm like, yeah. And that's how we get a lot of our patients in our clinic is, some guy will go to the golf club and be standing around going, hey, there's 7 of us here. That means 3 of us can't get our dick to work. Like, I went and found this out the other day. So if you can't, you can get it fixed. And a lot of guys will say that. I can't believe it. I had this, at golf, I had this conversation and they said, you can fix this. And it is. Erectile dysfunction is an easy fix. It is not hard.
Are most GPs asking about erections?
No. And I think that's really sad. I think it's 2 reasons, and I don't know what the situation is like in America, but in Australia, most GP consults are 10 to 15 minutes, and it's the way our funding model works. So if someone, and I don't work in general practice anymore, but I was, and this is one of the reasons I don't, because I found it really frustrating. Someone would come in and they have 2 things they want to talk to you about, and that you should ask that question, but you don't have time, because once you open that, I never have a consult less than half an hour to an hour. So once you open that conversation, you can't just go, oh, well, thanks for that. I'll chat to you about it next week. You need to finish it. So I think time is an issue. And I think the other thing is that in medical schools all around the world, and there's a lot of research on this, most people are lucky if they get 1 lecture on sexual function. And so they don't know. And I do a lot of education for GP groups and GPs. And usually the thing I'm asked to speak about the most is, how do I bring up sex with my patients? And there's a great cartoon that I show when I give those talks, which is a guy sitting on a hospital bed, on the edge of it, waiting to be examined. And he's going, I hope he asks me about my penis. And the doctor's going, I hope he asks if he's got a problem, because I'm too embarrassed to ask. Yeah. So I think there's a few things about that. We need to educate medical students more about how to have that conversation, and also how important your sexual function is, because that example I gave you with the erections and the cardiovascular, it's the same for women. Women will notice a change in their clitoral function and their orgasm if they're having cardiovascular disease.
Wow, that's great to know.
So if you are experiencing these issues, I want to get into fixes, things that you can do, but I also want to know, like, if a lot of GPs aren't educated on this, who should you go to? Should you start with your GP and just see where they refer you? What if they don't have the information? How do you access help?
So I think the first thing is definitely booking a long appointment with your practitioner. And I know in America you have nurse practitioners as well that work in general practice or advanced care practitioners. So you might want to book in with them and book a half an hour or the longest appointment you can, so you can actually bring it up. And I think it's okay for your practitioner to say, I actually don't know much about this, but I will refer you to someone who does. And I think also there is a lot of useful information online, but you just need to make sure you're going to credible sources. So I have an account in Reddit, and I cannot believe the crazy things that people ask and the crazy advice they're given. So every moment I have, I'm in Reddit going, no, that's not right, it's this. So, asking questions in those sort of forums, I think, can be really good, as long as when you get a reply, check that it is from a credible source and not just from some random. And there is also a lot of sexual health information on, like, I have a YouTube channel. There's quite a lot of urologists that have really good YouTube channels with great information. There's a lot of podcasts that have proper information. So I think it's just being discerning. I have a TikTok account and I put education on there all the time. So I think it's just about making sure when you look at these platforms, it's not all bad. It's just about being discerning about the information you get. I, for instance, have a program that I sell on my website just for erectile dysfunction, and it's pretty cheap, and it's 4 hours of tells you exactly the anatomy and what all the possibilities is of what might be going wrong and what the possible treatments are. And I think if you're really educated about your own body, we need to drive this stuff ourselves. Then you can go back to your practitioner and say, I've learnt all of this stuff from a credible source, and I'm pretty sure this is what's going on for me, and I would like to try X, Y, or Z. And then your practitioner can come back and go, oh, that's actually a really good idea. Because particularly a generalist, because not everyone has a sexologist in their town or city and there's two types of sexologists as well. There's clinical ones like me who can prescribe and treat, and there's others who are dealing mainly with the psychological side. So you might actually figure it out when you're learning about this that, no, I think mine is all in my head. But often it's not all in your head. Most of the time, it either starts off in your head and becomes physical, or it starts off physical and becomes in your head. So I think you really need it to be looked at from a holistic point of view. And it might be that you need someone like me who does the physical side and the psychological side, or you might have to have two different people helping you with that. But, the world is open to everybody now. So, I know that I refer patients that need a lot of psych to some other psychs that are in New Zealand and on the other side of the world, and I see a lot of people from the other side of the world's patients to discuss what the physical issue is, and then I might write to their general practitioner and say, I can't prescribe in Canada, for instance, but this is what I would recommend for this patient. So I think the options, it's probably the best thing to come from COVID. It's made the world, you can access these things everywhere, and the treatments are readily available. So I suppose have I answered your question? Should I move on to the treatments?
Yes. Yeah, that's perfect.
Yeah.
So the most common treatments are a group of drugs that we know called PDE5s. And PDE5s are more known as the blue pill, Viagra, which is called sildenafil. And then there's Cialis, which is the yellow pill, which is tadalafil. And then there's another drug called vardenafil, which is a pill called Levitra, and another one called avanafil, which is Svedra. It's important that we know that everybody responds differently to these pills. And what works for one person might not work for another, and there isn't one that's better than another. It's just like I have patients who Viagra works perfectly for them, and others that it does nothing at all, but Cialis works for them, for instance. And I think the other big urban myth about these drugs is that you can't take them if you have high blood pressure or heart problems. That is completely untrue. There are some heart issues you can't take them, and some interactions with heart drugs, but they were actually invented. Viagra was invented to lower blood pressure. So you don't get a red face because your blood pressure's high. You get a red face because it dilates your blood vessels, and it dilates them so more blood can go into your penis, but it does it in your face too. So, people are often like, oh, no, I can't take those. I've got high blood pressure. And it's like, no, it's going to lower your blood pressure. If anything, I'm going to also have to reduce your blood pressure medication. So don't just go and get one off the street and take it, but you do need advice around it. But it is safe to take them. There's also a new erectile dysfunction drug in Australia, which is Sildenafil, but it's in a nasal spray. So the tablets, Spedra only takes 15 minutes to work, but the other two take an hour to work. So there's not a lot of spontaneity, like you go out, you meet someone hot, you pick them up and you have to, no, there's no hot and heavy in the corridor. It's like you've got to take your pill, wait an hour and twiddle your thumbs while you're waiting. So this new nasal spray is going to be a game changer. At the moment, it's only available in Australia, but it's literally looks like you've got hay fever spray, one up each nostril, 15 minutes later, off you go. So I think it's going to be an absolute game changer for people with erectile dysfunction. The other thing is that, tadalafil in particular, you don't have to take it at the time. You can take a very small dose of it every day, which is what I would recommend for younger men or even older men who are having a lot of sex, because you don't want to have to worry about it at the time. So, and it's a bit of a passion killer. Oh, yeah, I'd like to have sex, but we have to wait an hour. So you can take a very small dose every day, and then it stays in your system so you're ready to go at all times. And it's actually really good also for your penis health, because if you have physical reason you've got erectile dysfunction, then your penis isn't probably having nocturnal erections. And a healthy man needs 3 to 5 a night to keep his penis healthy. And I can see your face.
What?
I'll talk a bit more about that in a bit. So you need, and so you want to be having those 3 to 5 a night while you're asleep in REM sleep, because that's what keeps your penis healthy. It takes your penis to the gym while you're asleep. So this daily dose, if you're not getting those anymore, that daily dose is awesome, because it will help with that. So you're actually taking your penis back to the gym when you're sleeping, and you're ready to go whenever someone wants you to be. So there's also the psychological aspects, which we'll chat about in a minute, but I might tell you a bit more about the penis function at nighttime. So when you're a teenager, you might have even more, like up to 10 erections a night. Every time a man is in REM sleep, he gets an erection. So if you've ever been in bed with a guy and he's spooning you, and you're getting poked in the back and it's 3 a.m. and you think, Jesus, we just did that a few hours ago. I'm not up for it again. The poor guy isn't hassling you for sex. His body is doing what it's doing. It's exercising his penis. Yeah, he's in REM sleep. And the penis is basically just a muscle. It's a smooth muscle. And every little one of those cells in there has smooth muscle. And all muscles need to be stretched and lengthened at all times, like exercised, or they shrink. So if you're working out at the gym, you get a big bicep, and then you stop going to the gym, it'll shrink. And that's why if you ever go into a nursing home and lift up the covers, all men look like they had tiny penises. They didn't. It just shrank because they haven't used it and they're not getting nocturnal erections.
Whoa.
So it's so important. And I always joke with my patients and say, I don't believe in God, but if there's a God, he's definitely a penis owner, because it is it's the only part of the human body. The clitoris does it too, but it's not as obvious, that exercises while you're asleep. So that's really important. And that's why penis pumps are so important. Penis pumps don't make your penis bigger than it is originally. That's silly. But if you've got a shrinking penis because you've been suffering from erectile dysfunction for some time and it hasn't been getting its nighttime erections, you can get your penis back to its original glory by using a penis pump regularly. It's just like taking your penis to boot camp.
I had no idea.
And just in case any of your listeners want to know how they know if they have erections at nighttime, there's a great new American product. It's been out for about a year, maybe a bit more now. It's called a Firmtech, and you can see them in my shop online. You can go through the link. But they're like a Fitbit for your dick. So, your Fitbit measures everything. You pop this. So we used to only be able to measure people's nocturnal erections by putting them into a lab at night time and putting a device on. But this is awesome. It's like a cock ring. You pop it on. It's soft. It's comfortable. I've made my husband wear one to see what happens. And it connects back to your telephone. So when you wake up in the morning, it's Bluetooth to your phone, and you have a little screen and you go, oh, look at that. I had oh, I only had 1 erection last night, or I had 5 erections last night. And you can also wear it while you're having sex, because it's just the right amount of pressure that it delays orgasm. And when you do orgasm, it helps you orgasm for a bit longer. So it's a sex toy, but it's also a fantastic diagnostic tool. So I love them. I get a lot of my patients to wear them before they're going to have pelvic surgery, so that I know what their pre-op function is, and then we can have a goal to get them back to. Or also to make sure people are getting nocturnal erections and the quality of their erections. And you can see how medications affect. So drugs like antidepressants can often give men erectile dysfunction, and sometimes that can be in their mind and sometimes it can be physical. So I think it's a really good thing, if you're going to go on a drug that might affect your erectile function, to know what your pre-function was like, and then measure it after you've been taking that drug. Mm-hmm. And then you can say, go back to your general practitioner and go, no, that drug you gave me is definitely, objectively, it is affecting my penile function. I would like to try something different for the same problem. Mm-hmm. And, you know, a big one for that is opioids, painkillers. And a good example is one of my clients was having leg surgery, and he'd been using the Firmtech ring, and we knew he was having 3 to 4 erections every night, and we had him on a low dose of tadalafil because he was in his 50s and we were keeping his penis healthy. And then he had to go on opioids medication whilst he was having this knee surgery, and for a couple of weeks after for the pain. He did not get a single nocturnal erection in that time, and it took a week and a half for that opioid to flush out of his body before his erectile function went back.
Wow. Oh my God.
So I think it's a really good way to measure your health, as to know that. And so, yeah, I think if you're really interested in that sort of thing and want to know where your health is at, and you want to know, have I really got erectile dysfunction, or have I got a physical reason, or have I got a psychological reason? So if you're having nocturnal erections but you can't get it up when you're with a partner, or even when you're masturbating, then yeah, we really need to work on what's going on in your headspace, because we know it can work. Mm-hmm. And so I also think, you know, I've seen a lot of men that have spent a year or more going and getting counselling for their erectile dysfunction, and then they've come and seen me and they actually did have a physical problem, and vice versa. I mean, a lot of people who come and see me they think they had a physical problem, and I'm like, no, you haven't. You know, we need to deal with what's going on in your headspace.
Wow. I learned so much just now about penises.
I always thought
wild.
Penis pumps were like a gimmicky, like shamey thing of like, your penis needs to be bigger, so you have to do this. That's so interesting.
I think the problem with penis pumps is they get a bad rap because they are marketed that way by unscrupulous people, but they actually have a fantastic function. It is taking your penis to the gym if you use them properly. And I've done a lot of YouTube videos about that. And, you know, if you're having 3 to 5 erections a night, you don't need one. But if you're not, then it is actually a really good adjunct to your health routine. So,
I'm sorry.
You go.
What is it? Will it make your penis bigger if you already have a healthy functioning penis?
No.
Okay.
No.
Good disclaimer.
That's the thing. People will say, oh, you know, I'm going to use a penis. You know, I've seen them advertise, get 4 inches longer or whatever it is, you know, absolute rubbish. You can't make your penis bigger. But, you know, penises do shrink a lot. Like I've seen men who have, I mean, most men take a picture of their penis at some stage. You know, I see guys that have come in and, I mean, I'm getting sent dick pics regularly, and this is not an invitation for your audience to send me dick pics, but I get them all the time. And, you know, patients will go, send me a picture and go, it used to look like this and it doesn't anymore. Is there anything I can do about it? And they'll come in and they're right. You know, they might have lost 3 or 4 centimetres in length and at least 2 or 3 in girth. And it doesn't happen overnight, but you can improve those things back to normal or close to normal with an exercise regime. So penis pumps definitely have a place.
Wow. The more you know.
Fascinating. The more you know.
The other thing I wanted to say about erectile dysfunction, I touched on it briefly before, is one of the other causes can be that hypertonic too tight pelvic floor. Mm-hmm. Mm-hmm. The best person to assess that, I mean, I can assess that, but I don't treat that. I then refer them off to a pelvic floor physiotherapist. Mm-hmm. And that's a very specialised area. You can't just go to any physiotherapist. You need someone who is trained in pelvic floor. in usually a master's. It's usually a master's qualification in pelvic floor. It's a very specialised area, but we often think about people. Oh, erectile dysfunction. I'll do Kegels. I'll get my pelvic floor really tight. But you can overdo that. Often the problem is not that it's not tight. That it's not tight enough. It's often that it is too tight, and then you're parking that car on the hose and not letting the blood through. And I've actually done a podcast recently with a young guy who had that exact problem, and he's only like 28, and he had a job that he hated. He was extremely stressed. Every time he had sex, his penis failed him, and we gave him some tablets for a short period of time just to get him some confidence back. And whilst we did that, I sent him off to a pelvic floor physio, and he learnt to relax, and he did yoga, and he did some breathing techniques, and he quit his shitty job that he hated and got another one. He was an engineer, and he was working in a field of oil and gas, and it didn't go with his own morals and ethics, and he was really struggling with that. And once he dealt with that side of his life, his penis started working again.
Oh,
Happy
I love
for
that
him.
story.
I was just wondering if we can get into more of those like psychological or lifestyle changes outside of like medication.
Sure. So the biggest thing is your weight. Like, having excess weight, particularly on your belly, is just blocking off the blood flow to your penis. And also, when you have a lot of fat cells produce estrogen. So even if you're a man who has a high testosterone level, like you're a young guy with a high testosterone level, when you're overweight, you have another thing called SHBG, which is a hormone that binds to the testosterone. So your total testosterone level might be great, but it's not usable to your body because it's stuck to this other molecule. So it doesn't matter how high it is, you need the free testosterone to help things work properly. And when you're overweight, you have more SHBG and you have more estrogen, which is the female hormone. And, if you have an estrogen and a testosterone imbalance, then your sexual function won't be as good. So the most important thing is you need to be in a healthy weight range and particularly avoid having extra belly fat. The second thing is smoking. Smoking blocks your arteries. We all know that. Erections revolve around blood flow. So vaping and smoking, and those things can be reversed within 6 to 12 months. So, it's not a case of, I've been smoking for 10 years, what's the point? It's stop, because they will start cleaning out and things will definitely get better. And then the other big thing is exercise. Like, when you're exercising, you're pumping blood flow all around your body, and penis function relies on blood flow. So anything we can do to get the blood flowing is really good. The other thing I'd really like to say is there's a lot of dodgy herbal remedies, get your penis bigger. Some of the names of them, they've left me now, but I have guys turn up with bags of stuff they've paid hundreds of dollars for, Hard Up and Boost Up and all these crazy names. And they're all full of the same herbs, usually rubbish. There are a few herbs that can help with your penile function, but you don't need to buy those really expensive concoctions. So curcumin, which is turmeric, the pure version of that is a great antioxidant and very good for blood flow, and it will help everywhere in your body for joint pain, blood flow, if you've got blood flow issues anywhere. And then there's two others, L-arginine and L-carotine, and they have been clinically proven to help improve nitrous oxide gas production, and it's nitrous oxide gas in the penis that causes the dilation to give you the erection. But you don't need to buy these combinations with fancy names. You can go to your herb shop, your health food shop, and buy those basic ones if you wanted a natural boost.
Gotcha. And then if it's more psychological, is the prescription for that to seek like counseling? Is it to talk to your doctor? What would that next step be?
I mean, and definitely counseling. You want to find out what's going on, and usually I find most sexual problems with couples and individuals are never really to do with the sex when they're a mental health issue. It's usually, you're disconnected from your partner. You haven't been having any fun together. You're stressed out at work, so you're always in flight and flight response. So you've got adrenaline pumping around your body and you've basically you're Superman with the kryptonite all the time. So, often you need counselling, and not pertaining to your sexual function, but about whatever else is going on in your life that's causing you stress and anxiety, so that your body can work how it should. So I think that's definitely the go. If it's in the moment, then, and I've heard other podcasts on yours, we're talking about mindfulness, and I think mindfulness works really well. And my simple way of explaining that to men is if they're having sex and they feel their penis going, what will often going down, they'll often go, oh crap, it's going to go down, or is it going to fail me like it did yesterday? Straight away they're going to get a dose of anxiety, dose of adrenaline, and they've just had a self-fulfilling prophecy. So when those negative thoughts are coming in, I say to think about something that they concentrate on, something they are really turned on by, or that is just concentrate on something else, the sound of the light in the corner of the room, or the feel of your partner's arm or skin or hair or something like that. Because if I said to you now, don't think about a pink elephant, what are you both thinking about?
Pink elephant.
Big old pink elephant.
But if I said to you, concentrate on that spot on the wall in the left-hand corner of the room, then you would concentrate on that and you wouldn't be thinking about the pink elephant anymore. So I think it's a very simple technique to try and train your brain to concentrate on something rather than keeping thoughts out. And I think it's always good to practice that mindfulness technique outside of the bedroom on a completely different thing, so that it's, practice makes perfect. When you feel that problem coming on in the bedroom, you can concentrate on something else, and then hopefully that thought process will go away and the anxiety and the adrenaline will settle down.
Earlier, you talked about position changes to help with in the moment ED. Are there any other things that we can do, like as partners, or that the person experiencing ED can do physically in that moment to help?
If you're the partner and you can feel the person's erection starting to fade, you can, and often guys will tell me this, they'll say, oh, my erection doesn't work, but if I grab the base of my penis really tight, like you would with a cock ring, then it will keep the blood in there for a bit longer, and then it can flow in. So a partner can definitely, start giving them a bit of manual stimulation, and that can often be quite enjoyable for the person as well. So it doesn't have to seem like, oh, I'm strangling the base of your dick so that it stays up. It can be part of the process, and it can be a stimulating experience for them and help maintain that erection a bit longer. And that also probably brings me to cock rings. I think cock rings can be really uncomfortable, and your average cheap and cheerful cock ring is, you're going to strangle the base of your penis, and all it does is the blood goes in, strangles the base of your penis, and stops the blood from flowing back. But you usually end up with a cold to touch, bluish tinged looking penis, which isn't very attractive, and particularly if you have a female partner. And also, it's not safe to leave a tight cock ring like that on for longer than 30 minutes because you're not getting any oxygenated blood to the penis. But that same company I told you about that do the Fitbit for your dick, they have a great cock ring called a Max Pro, and that you drop your testicles into it and it hooks. I wish I had one here, but I don't. It hooks over the top, and then what happens is it's only firm enough that it lets the venous blood that's coming back out of your penis to make it go down is on the outside surface, and the arterial blood goes through the middle, basically. So it is firm enough that it stops the venous blood from going back, but it is still letting you pump in fresh blood into the penis. They can stay on safely for 90 minutes. Your penis stays warm. It's getting fresh blood flow all the time. They're made out of a really nice material that's soft and actually feels good on your clitoris. And they provide just the right amount of pressure that they prolong the amount of time that your orgasm is there for a man. So they're great. They're a really good. So cock rings can be good, and they can be good for both partners. And there's also a lot of cock rings on the market with small vibrating devices in, which can also be fun and help maintain the erection for longer.
So many more options than you thought. And I love that company has the Fitbit for your dick and that additional cock ring thing. I'm thinking of like a blood pressure cuff. That could be a good type of cock ring, because then you could pump it up as much as you want, but also just
can you just back it off a little bit? Yeah. I know the inventor of Femtech, so I'll tell him that. I'll say,
that's all I ask.
What I've been asking him to do is my patients, because a lot of them have had prostate cancer surgery and their erections go completely at the beginning and then come back over the next 2 years. and they'll say, "Oh, I woke up in the middle of the night and I had a 10 out of 10 boner," and I just was like, damn, I wish I knew earlier because I could have woken up my partner. And I always say to the inventor of the Firmtech rings, you need to put a little alarm in there so it goes bzz, bzz, and wakes them up when they get an erection in the middle of the night so they can make the most of it before they're not getting one in the daytime yet. So he said he's considering it, I think. I think it'd be great. Imagine if you can't get an erection when you're trying because you've had surgery, but every now and then you get this wild one in the middle of the night and something gives you an alarm and you tap your friend on the shoulder and go, how about it? So,
now that's some spontaneity.
That's some spontaneity. Just a nice little alarm, like not the radar one on your phone because you don't want to get anxiety, but just like a nice little like twinkle.
Yeah, I was thinking it could just go bzz, bzz, and wake him up. It'd be great.
Yeah. I love it.
And if you were spooning your partner, they'd feel a little bzz, bzz on their back and you'd both be onto it. It'd be great.
It's time. It was amazing. Thank you so much for hanging out with us this evening. And where can our listeners connect with you after the show?
Yeah, so I have a podcast called The Penis Project, where I interview patients of ours and their partners about their journey and their sexual dysfunction and how they got through it. And I also interview specialists in the field around that. And maybe one day I could get you two on. It'd be great to hear why you started your podcast and what you're doing. It's excellent. And I also have a website, melissahadleybarrett.com, and a YouTube channel, melissahadleybarrett.com, and a Instagram of the same name, just my name. I also have a clinic, but the clinic's only open to people in Australia, but I do online consults and I've got programs and everything under my name. Amazing. And TikTok's my name as well.
Pump it up.
Yes.
How's that? But seriously, that explanation on penis pumps is one, really good to know, but two, kind of makes me sad for like all of the terrible marketing out there that is around penis pumps, because you and I both have thought that they were like kind of grimy, a weird like shame tactic to get people with penises to buy.
Yeah.
And the fact that all of that is mismarketed and this is actually a tool for people who could be experiencing ED for like physical or psychological, I don't know. It's just so interesting.
It's like, it's a health device.
Yeah.
And it's not marketed that way at all. It does feel grimy. And we have gotten many an email asking us to be sponsored by different penis pumps. And we've always said no, because we were like, no, we don't shame people's bodies. We're helping people. Turns out we are the problem. Honey, Do We Podcast
fucking lead.
is the number one reason for ED. Probably.
That could go so many different ways too. What a bummer.
What a bummer. But also, you know what?
Whatever. Well, we say no more. We stand here with Melissa.
United
as one. And say no more. So thank you, Melissa, for opening our eyes today and hopefully lifting our penises. And thank you to our honeys for hanging out.
What a beautiful closer. You can head on over to Apple Podcasts to rate, review, and subscribe to Honey Do Me. You can leave us a written review, which helps us so much. It gets the word out to other people. You can also rate us on Spotify, watch on YouTube. If you ever have an episode suggestion or a question, you can go ahead to the link in any of our bios on Instagram or TikTok and submit that there. You can also email us at honeydomepodcast@gmail.com if you ever want to have your question featured on an episode, and we'll answer it to the best of our abilities or ask it to an absolute expert. So with that, we will see you next week.
Goodbye.
Bye.